Whilst you've been in hospital, you've been receiving physiotherapy generally on a twice daily basis, and the focus of our early physiotherapy, particularly whilst in hospital, is about functional mobility and safety. So we've been doing things like getting in and out of bed, mobility exercises, walking with crutches, up and over stairs, those sorts of activities that you need to be able to safely do by yourself once you leave hospital. So once you've mastered those, then generally that's a pretty good indicator that you're ready to leave hospital safely. Now, when you go home, you do require ongoing physiotherapy, and so you would have been given some exercises from the hospital, and you continue those exercises in the interim period before you get to go and see your home community physiotherapist. So most people would attend their home physiotherapist probably on a once a week basis. Sometimes it might be a little bit more frequent depending on the circumstance, or maybe a little less. Physiotherapy is progressive, and so what your physiotherapist will do is to be able to assess your progress during the week and have a look at your overall function and mobility, and then prescribe to you ongoing exercises that are a little bit more challenging for you to be able to conduct, to be able to get faster recovery and function and strength. Physiotherapy in the early post-operative period after joint replacement surgery should really focus upon functional mobility and strength exercises. So that should form the bulk of what you're doing with the physiotherapist, along with useful functional advice in relation to your recovery process. What I don't want you to do with your physiotherapist is any activities that involve stretching and excessive mobility. So even though your hip feels stiff, I don't want you to do deep stretching activities with your physiotherapist at this juncture. Indeed, it's not helpful, it's not useful, and there is some degree of potential risk associated with those styles of exercise, particularly in the early post-operative period. The other thing I don't want you to do with physiotherapist is any deep tissue massage. And definitely not any needle-based acupuncture therapies anywhere near the wound, because these sorts of activities do place the wound at risk whilst it's still healing. If any questions arise with respect to your recovery protocols and physiotherapy in the post-surgical period, please give our rooms a call, and we'll be able to give you some advice.